Hey folks, welcome to DocTalk. Glad that you joined us today. We're going to have a great show. Dr. Brad White from the Department of Clinical Sciences here at the College of Veterinary Medicine at Kansas State University is joining us. We're going to talk about diagnosing and finding cattle that are sick with bovine respiratory disease. Thanks for joining us and stay tuned after this message.
Closed captioning brought to you by Kansas Soybean Commission, the Soybean Checkoff, Progress, powered by Kansas farmers. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Brad, welcome to the show.
Thanks, Dan.
Folks, this is Dr. Brad White, and he's joining us today. We're tickled to death to have him here. He's somebody that not just has a presence here in the state of Kansas, but has a presence nationally and internationally when it comes to bovine respiratory disease and some of the things that we see in the feedlots. And he's an associate professor in the Department of Clinical Sciences. And man, you do a lot of research, don't you?
Do quite a bit of research,
Yeah.
a lot with respiratory disease.
Yeah, well, it's a lot of good work, and we're very thankful you take time to spend time with us today here on the show.
Thank you.
So talk a little bit about some of the background of bovine respiratory disease and some of the things that you see or things that we're dealing with when it comes to bovine respiratory disease in the industry.
That's a good question. So bovine respiratory disease is a big problem in the industry, especially after we wean calves. And it's one of the diseases that we have a lot of trouble with, because just like people get pneumonia when cattle get bovine respiratory disease, they can have problems breathing, but it's hard to diagnose because their instinct is to hide that illness because they're a herd animal. So they don't want to be picked out from the herd, but would rather hide the symptoms. So it's hard to diagnose.
Kind of that predator-prey defense mechanism. Don't show your weakness and then you aren't the one that's preyed upon. Exactly.
They don't want to get separated from the herd. So some of the signs that we see, they don't eat as much, so they may not go to feed as often. They may act depressed, but all of those are subjective signs. So when we try to find those calves, it's very hard to pick them out when we're managing them as a group.
Okay. So when we do see some of the clinical signs, that you mentioned going off feed, but what are some other clinical signs of calves suffering from respiratory disease?
Yeah, so we see going off feed, they may be depressed, they may be separated or isolated from the group, so back to they want to be a part of that herd, but they can't maintain because they're ill. They may spend a little more time off by themselves and laying down, so not doing the normal activities that calves do. Really, we have to understand what normal calves look like, and they have variation in our behavior just like we do. They have variation in how they respond to illness.
Yep. So when we start to think about, some of the opportunities out there, obviously, if they're hiding their symptoms, there must be some opportunity there to improve upon finding them.
One of the real challenges is if we don't diagnose them accurately, then we run the risk of, if we don't find a sick calf and he's sick, we can't apply a treatment effectively. So we can't make him better, and the longer he's sick before we treat him, the more trouble we have with those calves. They don't respond as well to treatment. On the flip side of the coin, if there are calves that are out there that are healthy and we think they're sick, then we may be inadvertently treating them, which takes time and also some other resources to go ahead and treat them. So finding those sick calves accurately is really important. Right now, and we've actually done some research looking at how accurate we are, and it was one of the things that was humbling to me as we compared what does the calf look like, and then we look at their lungs. Very different stories sometimes, because they don't always tell us the full story by their behavior and what we see, because we see such a short period of time. Even in our research projects where we have time to spend a few minutes looking at each calf, you still aren't able to pick up what they're doing 24 hours a day. So the struggle is, how do we monitor and really find them more accurately?
Cool. We're going to take a break. When we come back, there'll be more with Dr. Brad White on bovine respiratory disease. Thanks for watching.
Next time you see a beautiful field of corn, reach out and thank the farmers who work tirelessly to raise corn. For livestock feed, renewable fuels, and exports to feed a growing world population. The farmers on the Kansas Corn Commission work for Kansas Corn with grower-funded checkoff dollars that support foreign and domestic market development, research, promotion, and education to expand opportunities for Kansas farmers. To learn more, visit kscorn.com.
Hey folks, Dr. Dan here, and I'm inviting you to come to the McCain Auditorium on October 12th to be a part of the Henry C. Gardner Global Food Systems Lecture Series, and the featured speaker will be Greg Page. He's going to discuss climate change in agriculture. When you think of climate change and the impact that agriculture may have on it, everybody involved with agriculture needs to be there. I hope that you can attend. We'll see you on the Kansas State campus. Again, that's October 12th, McCain Auditorium, and I'll see you down the road.
Watch Ag AM in Kansas online at agaminkansas.com. DocTalk, brought to you by Santa Fe Trail Meats in Overbrook, or visit us online at sftmeats.com.
Folks, welcome back to DocTalk. I'm Dr. Dan Thomson. I'm here with Dr. Brad White, who's a friend and colleague here at Kansas State University's College of Veterinary Medicine, talking about bovine respiratory disease diagnosis in cattle. And you know, as we left, you're kind of discussing, you know, that we're picking out the wrong animals.
Yep, and that is one of the hardest jobs out there. So even when we try to teach students, that's one of the hardest things to teach, and even producers that have been watching cattle day after day throughout their careers, it's one of the most difficult things to find a sick animal because they don't want to be found, they don't know that we're trying to help them. So when we've looked at studies related to accuracy, we see that even when a person is trying to find those sick calves, there's a percentage of the time that we miss, that we can't find them early in the process, or we call them sick, they're not truly sick. So we're looking at ways to try to improve that, make it a little bit better.
There's a lot of times we're pulling ugly, not sick.
That's exactly right. That's exactly right.
So
They may be ugly, they may just be off feed, they may have some other condition.
Hair coat, something that you just something's not right with that animal, but it's not BRD.
Exactly right. Exactly right. But when we only have a snapshot in time to look at them, so the average pen rider, if he's riding enough pins, only has about 4 seconds per calf each evaluation period. So in that 4-second period, it's very, very difficult to see what has that calf been doing.
Yeah, and the amount of animals that they look at. I mean, you know, if you're looking at 4,000, if you try to look at 4,000 anything in a day, let alone every 4 seconds.
Exactly right. Exactly right. And so it's a very, very difficult job.
Yeah. So you all have done some work and looked at some different opportunities, some rectal temp and blood samples, and try to fine tune to determine which animal's sick and when they are sick.
Exactly. One of the common uses is we'll take a rectal temperature. So we'll find a calf in the pen, we think he might be sick, we take him to the chute, we take his rectal temperature, and normal temperature on a calf is about 101.5, but in warm days it would be much higher than that, and it can be lower on cooler days. But a lot of times that 101.5, we may say there's a cutoff at which point he's sick, and then we decide to treat him. The problem is when we go back and look at some of the large data sets that we have access to through feed yards, that it's not very predictive if they're 103 or 104 or even up to 105 of what the case outcome is going to be, which is what we care about. We want to know, should I treat this calf or not? As you get to really high temperatures, then we have a better idea that they're sick, but our case outcomes aren't as good. So we want to find them earlier in that process. So rectal temp is not going to solve just our diagnosis problem, plus we only apply it to the calves we pull out of the pen.
Yeah, and the environmental change and its effect on rectal temp, we've seen it in dairy cows, seen it in beef calves. You know, it can be all over the board.
Absolutely, it's up and down, and we've done some studies in the summertime where we see rectal temp, it just varies a lot throughout the day, and then really depending on the night before. How much cooling time did we have? What was the low temperature?
And then as far as, you know, blood samples or following those calves out, what have you all learned or observed?
We've tried to test for several things. So we've looked from a research standpoint, is there something that would really augment what we currently do? How do we get better, and what samples could we take? And for the most part, most of those blood samples have not been very predictive of the true health status of the calf, which is disappointing, but not surprising, because we say BRD, and unlike a disease with a single pathogen, it's a syndrome. So it's not surprising that sometimes their blood values look like this or like this. So the simple answer is we don't have a silver bullet which will help us diagnose BRD. One of the things we found in those trials that was very interesting were some of the behavioral changes among those calves as it related to BRD.
Cool. Well, let's pick up on the behavior after these messages. You're watching Doc Talk. Thanks for joining us.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net.
Kansas Farm Bureau, the voice of agriculture, represents grassroots agriculture. The state's largest and most powerful farm organization stands up for its members through leadership development, agriculture education, legal defense, environmental advocacy, farm safety, and risk management. Members also enjoy money-saving benefits. To join our organization today or to learn more, go to www.kfb.org or find us on Facebook and Twitter.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Buying a car shouldn't be this hard. And at Brown Chevrolet Buick in Wamego, it isn't. It's actually awesome. Whether you want a new or used car or truck, Toby's team can make the deal. Even if you want to custom order a new car or truck, Toby's team can make the deal. See Toby's team at Brown Chevrolet Buick in Wamego. We're awesome.
Soil is the life of a farm, and for 25 years, SureCrop Liquid Crop Nutrition has helped growers produce abundant quality crops while preserving and improving the soils they steward. SureCrop offers complete soil and plant analysis with cropping recommendations, delivery direct to your on-farm storage, and quality crop nutrition custom blended for your field. Choose SureCrop for the assurance of excellence for your soil. Call today or visit their website for more information.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Watch Ag AM in Kansas online at agaminkansas.com. Doc Talk, brought to you by the Kansas Soybean Commission. The Soybean Checkoff, progress powered by Kansas farmers.
Folks, welcome back to Doc Talk. Dr. Dan Thomson here with Dr. Brad White, and we're talking about bovine respiratory disease. And Brad, you kind of walked us through, getting through the clinical signs, inability to find sick cattle, some of the things, tools that we've used to augment what we're already doing, whether it's taking a rectal temp or looking at some blood samples, and really we're not improving our ability to surveil these cattle or find them or even get a better treatment. So you've been looking now at some of the things with behavior, correct?
Absolutely. And so one of the things that we found is cattle behavior, just like us when we're sick, will show that behavior in different ways. So we'll behave different than when we're feeling normal. So as one of the early things that we did, we looked at activity. So cattle that are sick, as you would expect, they're less active. So they'll walk around less, they'll spend more time lying down, which was interesting for us as we discovered that you could really pick out which cattle were sick and which cattle weren't. It also changes their eating and drinking behavior, which is what we're looking for when we visually observe cattle to try to find illness.
Right.
The difference is when we visually observe cattle, we've got a snapshot. We go out, we look, this is the point in time, I'm here in the pen looking at the cattle. When we monitor behavior with a remote system, as we've been doing, we monitor it 24 hours a day, 7 days a week. So now instead of a snapshot, we've got the movie. So we can tell exactly what they're doing, and we don't have them modifying their behavior with the presence of a person in the pen.
You're getting past the sound bite. You're getting the whole story.
Exactly right. Exactly right. We get the whole story, so we get a lot of data, and as we sift through, we start to uncover some things that we didn't know before, and they change a little bit of our paradigm assumptions. For example, sick calves, and as we started out talking our typical, we say look for the calf that's kind of off by himself. That's right. Absolutely true. We see that later in the disease process. Early in the disease process, what we see is they spend more time in a group. The problem is, without remote monitoring, we never see that because it's very hard to say, go look for the calf that's spending more time with other calves. And unless you're watching the movie, you don't get to see that. So that's one of the things that we've uncovered that allows us to really change how we can find those sick calves.
There's probably a ton of things that you could use this technology for, whether it's when a cow's going to calve or...
Absolutely.
You know,
yep.
or
Those are
I was just sitting here thinking, you know, for opportunities, it's got to be endless.
Yep. So when they're going to calve, respiratory disease is where we start because it's the biggest issue that we face in weaned beef calves, but there are lots of other syndromes even for feedlot cattle or cow-calf or some of the other opportunities there.
So just for the people out there that are maybe not familiar with this technology, what is the name? It's ready.
So we're using remote early disease identification is the system, and so through our company Precision Animal Solutions, we're coming out with that remote early disease identification, or READY for short, is what we're doing.
Awesome. Is it available on the market today?
We're hoping to come to market in the next few months, so it'll be out soon.
Awesome. Well, I think as we head into the fall and different seasons of receiving calves, this is going to be really important to be able to touch on the behaviors. We're going to take a break. When we come back, we'll do a wrap-up with you and talk a little bit about READY and how it fits. But folks, Dr. Brad White, we're lucky to have him on the show. Thank you for watching Doc Talk. More after these messages.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica, Inc.
Hello folks, this is Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation out of Great Bend, Kansas. Today's BQA Tip of the Day, we're going to talk about bunk space management as well as pen densities. In this sort of scenario, one size doesn't fit all, and we must always remember that. One of the most critical time frames of pen density and bunk space management is when we're starting high-risk cattle. We want to give those cattle as much room as we can. The general rule of thumb I use is if we're starting high-risk cattle, every animal must be able to come to the bunk at the same time. If you're looking at those cattle and feed them in the morning and not every single high-risk animal can come to the bunk at the same time, we need more bunk space. May not necessarily do anything positive for the economics initially, but on the back end in terms of economics, it will pay on the front end to give them 18 inches of bunk space. We want to give them that bunk space to reduce stress, let them get good feed intake, also give them a good amount of space in the pen. That's our tip for today. Thank you.
Earlier in my life, I rode bucking horses and rodeos, and my shoulders took such a beating, and that was probably the reason for having several previous surgeries on both shoulders. About a year ago, I decided that I didn't want to have another surgery. And so I contacted Kansas Regenerative Medicine, took their treatment process. It was relatively pain-free. Now, after 8 months, my shoulders have healed to the point where I think I'm probably 90 to 95% of normal. It takes a couple of months to start to see results with stem cell injections, but at about 3 to 3.5 months, I started to feel better. I started to have less pain and feel real progress. That continued to increase gradually until now at approximately 8 months. And I'm extremely pleased. I've got full range of motion. I can lift weights, I can throw, I can do a lot of things that I couldn't do without a lot of pain previously.
Hey, it's Dr. Dan here, inviting you to Animal Science and Industries Family and Friends Reunion.
Whether you're an alumnus, a family member, or a friend like myself, I would encourage you to attend the Family and Friends Reunion on October 9th as a way to network, connect, or reconnect with friends of yours in your segment of the livestock industry.
K-State has many traditions. Agriculture and football are at the top of the list. So I'll see you in Manhattan, Kansas on October 9th for the Animal Science and Industries Family and Friends Reunion.
Healthy cows start with the new hired hand automatic livestock sprayer, Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
When your living depends on agriculture, you can depend on KFRM 550 AM. If you're in the southwest three-fourths of Kansas or the northern half of Oklahoma, catch us at 550 AM on the radio dial. But if that isn't you, listen on your cell phone at TuneIn Radio or on your computer at KFRM.com. We promise to keep you informed, entertained, and company as you go through your day. KFRM 550 AM, the voice of the plains. We would like to join your management team.
Kansas Farm Bureau, the voice of agriculture. To join today or for more information, go to kfb.org or find us on Facebook and Twitter.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Brad White, who's an associate professor in the Department of Clinical Sciences at the College of Veterinary Medicine at Kansas State University. We're talking about some great technology that he's been a part of developing and bringing out is the READY system and the remote early
disease
identification system. And let's talk a little bit about, you've done some comparisons already.
Yep.
And it's pretty cool.
Yeah, so we've seen some really interesting things when we compare it to a person. So we've taken cattle and monitored them with both the person and the system. What we see is the system, as you might expect, because it's monitoring behavior 24 hours a day, 7 days a week, it's finding those calves earlier. So we see that we'll find them on average 18 hours earlier, but a lot of times we're 3, 4, 5 days before the person does, because those behavior changes are subtle. Just like we talked about spending more time in the group, we pick up on that. So what we expect, if we can find those calves early treatment, better case outcome is what we're looking for. So we've seen that we can accurately find those calves and we get better case outcomes. So in a recent trial that we did, there were a few pens, and we compared 600 head monitored with the READY system to 600 head monitored with a person. At the end of the study, we had 10 calves that ended up being treated and died in the READY pen and 19 calves that ended up dying in the person pen. So we had the exact same number of pulls or sick cattle, but the death loss was different, our case outcomes were different. We found them at a different time, on average about a week earlier.
And when we have some of the things that, associated with antibiotic resistance and decreasing antibiotic usage, you've also done some pretty unique work on replacing metaphylaxis or mass treatment on arrival.
Yeah, so when we look at one of the common tools, if you were receiving a group of calves that were at high risk for bovine respiratory disease, you would likely treat them with an antimicrobial, give every one of them antimicrobial or metaphylaxis at arrival, because we don't know which ones are sick and which ones aren't. And that has been a technology that has been shown very effectively to work very well at reducing the number of sick calves, cut them by half. So what we thought we'll try against the conventional standard metaphylaxis compared to READY and no metaphylaxis. What we found was we ended up with about the same number of pulls, no difference in the number of sick calves, no difference in the number of dead calves, but we used one less dose of antibiotics. So we were able to save that initial dose because of our accurate diagnosis. Made a difference, again, good case outcome, finding them earlier.
Yeah, decrease not only on the problems that we have societally with antibiotic use and antibiotic resistance, but the cost of production decreasing those cattle.
Absolutely, and it changes our labor. So we don't replace a pen rider, but it's a good system to augment and make the best pen riders better. It gives them something else to go on, another tool in their toolbox that they can rely on to help do their job even better as they go through, because it's one of the toughest jobs in the field, is finding those sick calves.
Yep, and when the snow's blowing down the back of your neck and you're out there working, I really appreciate you being on the show. Great technology. Keep up the great work, and we want to have you back.
Thanks, Dan. Appreciate it.
And thank you for watching DocTalk. Remember, always work with your local veterinarian, and if you want to know more about what Dr. White and I do here at Kansas State, you can find us on the web at www.vet.ksu.edu. Thanks for watching DocTalk today. I'm Dr. Dan Thomson, and I'll see you down the road.
Closed captioning brought to you by Kansas Soybean Commission. The Soybean Checkoff, Progress, powered by Kansas farmers.
To see this show and past episodes of Ag AM in Kansas, go online to agamnkansas.com.